Hey, welcome in. I'm so glad we're doing this today. We're going to break down what is truly one of the most foundational skills you'll ever teach as a lactation consultant, hand expression. Seriously, mastering how to teach this isn't just a nice-to-have skill, it's a core competency. It's how you empower parents and build their confidence right from day one. So, you ready? Let's get started.
So here's our game plan. Think of this as the perfect roadmap for when you're sitting down with a client. First, we're going to hit the why. This is all about getting them on board. Then we'll walk through the prep work, the actual hands-on technique, how to get the most milk, and of course, how to handle those common questions that always pop up.
Okay, so before you even think about showing someone how to do it, you have to sell them on why. This part is so important for building buy-in, especially for parents who are thinking a pump is the only way to go. Now, when you're talking to a parent, how do you make these points stick? Well, you can explain that hand expression helps them work with their body to actually encourage that letdown reflex. And you can talk about the freedom of it all. You don't need any special gear. It's always there for you, even if the power goes out. And this is the big one. For those first few days, it is hands down the best way to collect every single drop of that liquid gold, that colostrum.
All right, let's move on to preparation. You really want to teach your clients that success here often starts before a hand even touches the breast. It's all about setting the stage, both in their environment and in their own mind. These first three steps, they're totally non-negotiable. You want to stress how important it is to wash hands really well for hygiene, right? And to have a clean container ready to go so there's no frantic scrambling later. Finding a comfy private spot, that just immediately sets a tone of safety and calm. This right here, this is a physiological fact that you need to drive home. Tell your client that creating a calm space isn't just a fluffy, nice-to-have idea. It is a full-on clinical intervention. Stress hormones like adrenaline can literally block oxytocin, which is the hormone that makes the milk flow. So, you see, relaxation is actually part of the work. And here are the tools to make that relaxation happen. You can present these as proven techniques to help trigger that milk ejection reflex. You know, just seeing the baby or even smelling a little piece of their clothing can have a surprisingly powerful hormonal effect. Just encourage parents to play around with these and see what clicks for them. All right, now we're getting to the heart of it. This is the how-to part of your teaching session. We're going to break down the physical steps so you can demonstrate them super clearly and with a lot of confidence. So before even trying to express, it's a great idea to start with this little warm-up routine. I like to call it waking up the breast. It's just a firm, circular massage, then some gentle stroking towards the nipple, and then leaning forward and letting gravity do its thing with a little shake. This whole sequence basically sends a signal to the body that it's time for milk to flow. Okay, let's talk hand position. The C shape is the absolute foundation of doing this effectively. You want the thumb on top and the fingers below, and they should be placed a good inch or two behind the areola. That's where all the milk ducts are hiding. The motion itself is a really simple three-part rhythm. You just have them remember this. Press, compress, relax. First, they press straight back towards their chest wall. Second, they compress, bringing their thumb and fingers together to move the milk forward. And third, this is the part people always forget, they relax completely before starting over. This rhythm is meant to mimic how a baby suckles, and that's the real secret to getting milk without causing any pain. You know, it's just as important to teach what not to do. Make it clear that sliding their fingers on the skin is just going to cause friction and irritation. And squeezing the nipple itself, ouch. Not only is it painful, it's totally ineffective because all the milk is stored behind the areola, not in the nipple itself. Okay, let's put it all together into the full routine. So the strategy is warm up both breasts, then express from one side until the flow starts to slow down. Then, and here's the magic trick, you switch to the other breast. That switch often triggers another letdown. Repeating this cycle back and forth a few times is how you're going to maximize the amount of milk collected in one session. Sooner or later, you're going to get asked about pumps. And that's great. Many clients will use one. So it's really important to show them that hand expression isn't an either-or thing. It's actually a superpower that makes their pump work even better. This is what we call hands-on pumping. By massaging before and during a pumping session, and then doing some hand expression for just a few minutes after the pump is off, a parent can seriously increase their milk volume. It helps drain the breast so much more effectively. For anyone trying to build or maintain their supply, this is an absolute game changer.
And finally, this is what separates a good teaching session from a truly great one: being ready for their questions. This is where you really build up their confidence and solve little issues before they turn into big problems. Oh yeah, you're gonna get this question a lot. How long is this supposed to take? And it's a totally fair question. The key here is to manage their expectations in a realistic, encouraging way. You can reassure them that, yeah, it might take 20 or even 30 minutes when they're first learning, but that speed really does come with practice. But here's the most important takeaway for them. Consistency is way more important than duration. A few short sessions scattered throughout the day will do way more for their supply than one long, exhausting one. Okay, this one is your critical safety check. Your answer has to be direct, it has to be clear, and it has to be absolute. So the answer is an unequivocal no. Hand expression should never, ever hurt. Explain that pain is the body's way of screaming that the technique is off. And it's more than just discomfort. Pain actually works against them. It inhibits the letdown reflex. So if it hurts, the rule is you stop and you readjust your hand position or the pressure. Always try to end your session on a really powerful, reassuring note. Remind the parent that this is a brand new skill. It's like learning to ride a bike. It feels super awkward at first, but with just a little bit of practice, it really does become second nature. Honestly, your confidence in them is often the most important thing they'll walk away with.